This is a nasty case of bloody, blistery eczema. What would you do if this was you? Or what would you do for a patient if this was your patient? So let's go over this a little bit. This is a 77-year-old woman. It could be a 77-year-old guy. It could be a young kid, because lots of young kids also have nasty cases of eczema like this. So before her eczema emerged, she suffered for years with cold sores, an itchy scalp, and chronic musculoskeletal pain. After all of that, and the misery of all that, then the eczema emerged. And for whatever reason, she didn't go to a dermatologist, so she didn't get loaded up with, well, it could be cortisone cream or oral corticosteroids or something else. So she didn't do any of that stuff. So what did she do? She decided, now also you have to think, how much money would it cost to treat this with those medications or advanced diagnostic testing, or if she went to someone who does lots of nutrition-related testing? Very, very expensive. She spent 25 bucks and got a copy of the DeFlame Diet, and at about 4.5 months, not quite 5 months, this was her outcome. And all she did was follow the DeFlame Diet recommendations, which pretty straightforward. So here you go. Completely gone. All of her symptoms completely gone. Now you can see she's not very heavy, obviously. She weighs 100 pounds now. She started off at 110 pounds. So this just demonstrates that one need not be overweight or obese to be chronically inflamed by their diets. You can be thin as can be and still be brutally inflamed if you're living on what, of course, I call dietary crack, which is what you see at the bottom of the image of the DeFlame Diet. So all she did was absolutely wash these calories away and replace these calories with vegetation. I mean, that is the key for the average person to do. Now, the nasty eczema-looking image on the left side doesn't really do justice to the sort of the bloodiness that she had in her hands. So let's look at her hands. Check this out. This is blistery, bloody eczema. And again, in less than 5 months, this was the outcome. Completely healed, or I mean, not perfect, but certainly, comparatively speaking, completely healed. And again, chronic pain was gone, itchy scalp was gone, whatever the other symptom was, that was gone. She had what else? Cold sores, gone. So this is the power of diet. One need not go crazy with insanely expensive supplements, magical potions. They have value. Your typical botanicals and other nutrients have values. I mean, my book describes what I think are the best supplements, but nothing is more profound for the human body than getting rid of pro-inflammatory calories. And it's a little bit difficult for a lot of people to imagine, because people think that they have to take something. What do I take to treat my bloody, blistery eczema? And that's not the right question. The right question is, what should I remove from my lifestyle that is pro-inflammatory? Now, I've been thinking about this since 1987, looking at it this way. So I always move or default to removing pro-inflammatory stuff. So this was an image I created back in 1993, and you can see here's an old dude. He's living on pizza, cookies or chips, whatever that bag is, I forget, and then beer. And so once we eat like this, we end up producing excess pro-inflammatory chemicals. Now, if you have some biochemistry background, or you're a physician, you see, well, potassium ions, why is that there? Well, the reason why is because after tissue injury, potassium ions are released and they irritate nociceptors. So 26, 27 years later, I would probably not put potassium ions there, obviously, and I wouldn't even really talk about lactic acid. The biggies are going to be your eicosanoids and your cytokines, which are the most important. But this, again, was 26 years ago, and good luck finding any picture about diet and inflammation prior to 1993. So this, as far as I know, was the first image that was ever put together that illustrated how eating pro-inflammatory calories can create inflammation and pain. So again, I always look at, we have to remove pro-inflammatory calories. We don't eat like this and then take supplements or drugs. Now, that's just a foolish way to look at it. So 5 years later, I wrote the first book on inflammation and nutrition. You see, clinical nutrition for pain, inflammation, and tissue healing. And what informed me back then, and I've modified these images and made them more advanced, but you can see the various images that I put together back in the early mid-90s and then put into this book. And so, in particular, this is your omega-6, omega-3 fatty acid cascades, which is a lot more complex now. So after I created this book, I started writing some articles because I wanted to get this information to the scientific literature. And so the first paper I published was, in this context, was in 1999, related to chronic pain syndromes. And then the most recent would have been an obesity article published in 2013. And here are the articles. You can see this is the pain article from 1989, sorry. This would have been 2013, and this one would have been 2002. And so these 4 papers have been cited by researchers at Harvard Medical School 3 times, many other universities in the United States, a researcher at the Centers for Disease Control, and then multiple other universities in various countries around the world. And so after going through these papers, I decided to write the DeFlame Diet book to get this information out there because, again, the whole inflammation nutrition approach typically is not focused on the overall expression of inflammation as a consequence of living on inflammatory foods. It's much more like, what do you take for inflammation or reduce for inflammation, or just focusing on things like omega-6 fatty acids. So here is an image from the DeFlame Diet book that will help you conceptualize how to look at this for yourself and for patients. So there I've got 4 circles, and the outer one is the most obvious. You see all the names, people's eyes go right to that because they're looking for their condition. What we should be doing is looking much more at our pro-inflammatory diet and lifestyle, and then circle 3 are the markers. Now, circle 2 is the biochemistry of inflammation. This is of interest most to researchers and physicians, not so much, obviously, to the average person. So for the average person, we want to focus on normalizing our pro-inflammatory diet and lifestyle and keeping track of all of the markers that we can. And lots of them you can do just sitting at home with tape measures and BMI stuff on the computer and waist-to ratio. Very, very simple. And you can get lab work done. And it all typically correlates. And so the focus should not be on treating breast cancer specifically without consideration for 1 through 3, or what do I do for acne or asthma or whatever condition is, because there are medications for all of these conditions. There are some supplements, not too many, but for some of these conditions specifically. But we have to normalize the pro-inflammatory state. So how should we do this? The best way is to let the names of the conditions kind of blend away, so you don't really think about them. And so you can see how I blended them out here so they're not quite so clear. And what is most obvious now in terms of the image are these markers in tier 3. So you want to focus on normalizing your markers, because when those markers normalize, these conditions will either be prevented or they tend to reverse. So if you are overweight, like that individual, the 77-year-old woman with the eczema, she didn't have to worry about weight loss, obviously. But if you are overweight, then you want to know what the weight loss secrets are, so you get your situation under control, so you can get your circle 3 markers normal. And of course, whether obese or lean or thin, and most of these people tend to be skinny fat, the ones who are inflamed and thin, have to get rid of pro-inflammatory calories. And when people move in that direction, they typically have lots and lots of questions. What about this? What about that? I heard about this. What should I do about that? So there's 250 pages in this DeFlame Diet book, and it addresses most of the questions that people come up with. But the focus should be always not grasping mentally in on the name of your condition, focusing on your pro-inflammatory markers that you can measure at home and with the assistance of your physician, and then eat anti-inflammatory and watch many of these conditions completely reverse. Not all, obviously, but many of these conditions can completely reverse, like you saw with the 77-year-old woman who, in less than 5 months, had her bloody blistery eczema and chronic pain completely gone. And that could be you. Just go to DeFlame.com, click on the books, and off you go.